My specialty is called physical medicine and rehabilitation, called a physiatrist. I focus on patients who have spasticity from neurologic disease. The main diagnoses are patients who suffer from strokes, brain injuries, multiple sclerosis, spinal cord injuries, and cerebral palsy. Spasticity is really just as much of an orthopedic disease as it is a neurologic disease. Sure, the stroke causes spasticity. Sure, the multiple sclerosis causes spasticity. Sure, the cerebral palsy causes spasticity. But this leads to a tremendous amount of orthopedic complications as well. I'm not able to treat their neurologic disease. I can't take away someone's stroke, someone's multiple sclerosis, someone's cerebral palsy, or spinal cord injury. But what I can do is I can treat their underlying spasticity if it is impairing with their level of functioning. My job is really trying to find out what they can do and what they can't do from a neurologic and strength perspective, and then treating the spasticity if it's impairing that level of functioning, to try to really liberate them to do what they can do. For example, if someone's had a stroke, this is one of the common postures that we see post-stroke. We have a flexed elbow, a flexed wrist, and the fingers are clasped shut. If they don't have any neurologic functional use of that hand, then I can treat them with Botox. Inject some Botox into your arm, okay? It has a tremendous relaxing influence on the muscle, so it's no longer as tight. It would make caregiving easier, getting dressed easier, decrease some pain and discomfort from being like this. If a patient is suffering from more diffuse spasticity, especially in multiple muscles of their legs, then we treat them with what's called a intrathecal baclofen pump. Right? Yep. And that can really tremendously relax their spastic muscles in their legs and make them a lot more comfortable as well. There is treatment available for the condition of spasticity. It is FDA approved, it is a standard of care, but there's very few doctors doing it. Being able to do this here and offering this service within Rhode Island is really tremendously valuable for these patients. These are patients who have suffered a really catastrophic neurologic accident. Something has happened to them. And driving 50, 60 miles is really very difficult for them, especially in really bad traffic. It's too much. They have severe strokes, severe multiple sclerosis, severe neurological disease, and doing it here, in addition to in Boston, is very helpful to them. It's very important to get treatment before a joint gets stuck in this position, before a joint gets contracted, because at that point, it's much harder to treat. If I can treat them early, then I can prevent those things from happening. If it's really been a long time that they've been this way and the muscle or joint is stuck, at that point, I would need help from my orthopedic colleagues to help open up a patient's fingers or release their ankle so it's not quite as tight. Having these world-class orthopedic surgeons here under one roof and these excellent physical and occupational therapists, that is tremendous. To be able to discuss with them what we can do to try to keep the patient in the game, to try to keep them as functional as possible, to try to keep them as comfortable as possible, to try to keep caregiving as comfortable as possible for them as well, is really what these patients with these disabilities deserve. Getting to really know the patients, helping them in ways that very few other providers can, and seeing them stay in their home, go out, go dancing, going out to eat, being involved with their families, keeping them as functional as they can be. And that's really what proper spasticity management is about. It's about enabling patients to be able to maximize their level of functioning, which is being impaired by spasticity. That's my job, and I love doing it.